But if people do not listen and they don't stay in and they continue to go out, even though this has now been enforced on us, we are going to just have to do it for longer. Hello everybody and welcome back to my channel, or welcome to my channel if you're new. Today I had ideas planned for what I was going to film, but I kind of thought with the current situation going on, I want to talk about what that means for dentistry. By the current situation, what I mean is the coronavirus, COVID-19, and how that has affected the whole entire world, but specifically dental practices. In the media, there have been stuff about teachers, NHS workers, frontline workers, people that are working in the shops, which is incredible. Those people deserve all the credit possible to them. But what we've heard nothing of is how this has affected dental practices. We are the ones that literally are working in people's mouths, putting ourselves at such a high risk because we work in such close proximity with patients. As of last night, which was March the 23rd, the Prime Minister gave an announcement that the country was to be, he didn't use the term lockdown, but basically we can only leave our houses for essential needs. Most workplaces have shut down. Hairdressers, clothes shops, electronic shops. Anything that isn't essential to the running of this country has shut down, and people are being urged to work from home where possible. Now, this is all information that everybody already knows because it's so public and it's so out there, and this affects everybody. I don't think there is one person in the entire world that this situation isn't currently affecting. I'm just going to go now to what my practice have specifically done to safeguard not only staff but patients as well. The practice owners have come to an incredibly difficult decision to shut down the practice and see just urgent emergencies only. So the decision was made to safeguard the staff and any patients. Following the government guidance that has been put out for everybody to stay at home unless it's urgent, this decision was also made to comply with that. If we are still seeing patients for checkups and non-urgent things, that means them leaving their houses to come to somewhere that is not necessary at this time. I personally feel like this was the best decision they could have made for safeguarding reasons, because this means that they care greatly for their staff as well as their patients. They are willing to lose their normal financial income. We work in such close proximity to the patients, within inches, sometimes within centimetres. We too are putting ourselves at risk by seeing unnecessary patients. And I cannot thank you enough to my practice that has made this incredibly difficult decision. Now obviously once this all blows over and calms down, we will reopen again to our normal patients, to everybody else that isn't in urgent need of an emergency. Things will eventually go back to normal, but that doesn't mean that this situation is not going to have a massive toll on everybody for a long time. We still have to pay our registrations and our indemnity insurance. At the minute, there is nothing to say that they are going to reduce this cost or put it back slightly, but people aren't earning the income that they were. To comply with the government's advice and now enforcement that we need to be staying at home and not going out unless it's essential, we cancel every patient. And the way that we are working, and that I know a lot of other dental practices are working, following guidance from the powers that be, is that there is a triage system. We operate a closed door policy. The doors are closed. There is a sign on it to say if you need to speak to a member of staff, you are to ring and somebody will pick up the phone. You cannot come into the practice unless you have a booked emergency appointment. Now the triage system is put in place to basically rule out the patients that say they are an emergency, but really it's not at all. So many patients ring with an emergency that is not in any way an emergency. A broken tooth isn't an emergency unless it's giving you severe pain, cutting your mouth open because it's so sharp, bleeding, or you've experienced serious trauma. A lost filling isn't an emergency. So the triage system is in place so that when the dentist rings you back, he can answer all of your questions. And if he or she feels like it is absolutely essential that you need to be seen, you can come to the practice. If you have the option to stay at home, please just stay at home, because you will, not could, you will save lives. And even if they're not presenting with any symptoms of the coronavirus, that's not to say that they don't have it. And in dental practices, we don't have the PPE that is needed to treat somebody with this virus. There's not enough kits out there. There's hardly enough kits to actually serve the people working frontline in all of this. If you don't have to go to the dentist for an urgent emergency, just don't go. We consider these severe pain, bleeding that you can't control, something like an infection where there's a lot of swelling present, or trauma. So for example, if you've fallen and you've knocked your 2 front teeth out. Anything else very, very likely won't be seen by most practices, because it is not essential that it gets done straight away. Now, I completely understand that everyone is in the same boat here, but if you go to a practice that is still seeing patients unnecessarily, please just cancel the appointment, because you're not only putting yourself at risk, but you're putting them at risk, their families at risk, and any other patient that also must come into the building at risk. Now, as dental practices, we have an extremely high cleanliness rate. We are trained to see every single patient as if they are infected with things like HIV and hepatitis, anything that we can possibly catch. We are trained to treat every patient as if they have that. But COVID-19 is a whole new ballgame. We are not prepared to deal with something that spreads as easily as coronavirus spreads. A profession that has such a high standard of avoiding cross-contamination, because that's literally what we are trained to do. They're not prepared for something like this. And that is why so many practices have had to shut down to safeguard everybody. I think I'm pretty much out of things to talk about on this video now, but I just wanted to make this video so that everybody was aware of the implications this was having on specifically dental practices. I completely understand that every other business is in the same position, but we work in such close proximity, and I think a lot of people forget that. So thank you to my specific practice for making the decision that they have made. And thank you to every other dentist that has had to make this decision about their practice. As nurses, we say thank you for putting our safety and our patients' safety top of the priority list. And thank you to all the nurses out there that are still currently working. Thank you to every hygienist that is now not able to work. Thank you to every practice manager that has managed your practice and dealt with these decisions being made. Thank you to all the receptionists that are having to sit at their desks and cancel every single patient. I know that's tough because I've had to do it. So if you can, stay home. To all the NHS staff and the ones that are putting their lives on the line to save people every day, thank you. I'm not going to do my normal outro to this video because it's not a normal video. And I also want to say thank you to every single NHS worker that is putting their lives and their families' lives potentially on the line to help those that need it. Thank you to every single key worker out there, to teachers, to those that look after the elderly, to those that work in any kind of health and social care environment, and any that I haven't mentioned that is classed as a key worker, or anyone still going to work to help our country run. Thank you.